Hello, and thank you for joining our side event, Hand Hygiene during COVID-19 and beyond. My name is Ron Klemmer, and I'm with the Global Handwashing Partnership. The Global Handwashing Partnership is a public-private partnership providing leadership to advance handwashing with soap. This side event will be 1 hour and 45 minutes long. In that time, we'll cover the why of the importance of handwashing, and then we'll cover the how of best practices to address handwashing programming during COVID-19 and beyond. I'd like to note a couple of housekeeping items. Participants should be muted throughout the session. Please use the poll feature on Pathable to type in any questions you have for the presenters or for any questions for the panel. And again, that's the poll feature, not the chat box. You can download today's slides and additional resources through the Files tab at the event link. The side event, along with the conference side events, all the conference side events, will be recorded. The recording will be available a few hours after this event ends. We are dedicating this side event to the late Professor Val Curtis, who was such a great advocate and leader for handwashing. In 2001, she saw the potential of bringing business, science, and policy together to promote hygiene. Through her passion, charisma, and evidence-driven approach, she co-founded the Public-Private Partnership for Handwashing with Soap, which later became the Global Handwashing Partnership. Her creativity and advocacy efforts contributed to the establishment of Global Handwashing Day. So at the Global Handwashing Partnership, we have a great debt to owe to Val's efforts. Indeed, Val's leadership and impact has influenced the work of all hand hygiene actors and will continue to do so for years to come. We are going to have a great side event today. The COVID-19 pandemic has emphasized the importance of hand hygiene as an easy, cost-effective barrier to disease transmission. For the first time in history, hand hygiene is getting the spotlight it deserves. But we want to make sure hand washing efforts are done well to have a lasting impact beyond COVID-19. Like the UNC conference, this session brings together science, policy, and implementation actors. We'll start with some science presentations, which detail the evidence behind hand hygiene as a potential factor and its projected effectiveness for COVID-19. Following the presentations, there will be time for questions to the presenters. Then we will move on to our moderated panel to discuss implementation of hand washing programs. We'll end the side event with a presentation on the Hand Hygiene for All global initiative, which calls for accomplishing universal hand hygiene through a whole society approach of increased political leadership, a strong enabling environment, and robust supply and demand for hand hygiene facilities and supplies. We are pleased to have Dr. Bibhab Sansguri from Unilever as our first presenter today. He is the Global Vice President of R&D for Skin Cleansing and the Executive Director R&D of Hindustan Unilever. He will be presenting the basic concepts behind hand hygiene. Bibhab?
Thank you so much, Ron. And thank you, everyone. It's a real honor and a pleasure to be here and speak to you a little about our understanding of soap. So on to the next slide, please. I'd like to just start out with a couple of slides that give you an understanding of Unilever, if you haven't heard about it. We're a global company and we make many of the world's favorite brands. One of them in particular that is prominent in the discussions that we will be having today a brand called Lifebuoy. And those numbers that you see on your screen are a representation of our reach, as well as the number of people whom we actually touch through our products every single day. The next slide, please. Um, and I think Unilever has led the way in terms of bringing purpose and sustainability to the way that we do our business. It's embedded within our business, and our vision is really about doing business in a way that it delivers growth by serving society and the planet. And therefore, when you talk about hand washing and its impact in reducing the burden of disease through prevention, it really is at the core of our purpose. The next slide, please. So soap, as you know, has been a recipe for health all through the ages. A very simple product that was invented thousands of years ago, literally by accident by the Babylonians, and democratized by Lord Hesketh Lever. And it was in the form of two soaps. The first one, Sunlight, which was introduced as a means of both washing yourself as well as clothes. And then Lifebuoy, which was introduced more than 120 years ago, specifically in response to the outbreaks of cholera in Victorian England. And like Ron mentioned, soap has now become viral, if you pardon the pun, by the SARS-CoV-2 virus. And just an interesting little fact, every year Unilever makes about 9 billion soap bars, which when laid out end to end can actually reach the earth to the moon and back. Next slide, please. It is well recognized that prevention and washing your hands with soap is one of the best ways to protect yourself against infections. And this has been highlighted very strongly in the current context, where organizations like the WHO and the CDC, etc., have spoken about the importance of washing your hands for at least 20 seconds with soap. And I'm going to use the next couple of slides to explain to you the science behind soap and how it works. Next slide, please. So for those who don't know what soap is, when you hold a soap bar in your hand, it basically is made up of two parts. The first one is really the longer chain fatty acids. And this is really what gives you the bar structure, the brick-like appearance that you have with the bar. And the second part of the soap is the lathering component, the part that generates the lather and the one that actually targets the germs. And these are shorter chain carbon chains, typically in the range of about C12 or so. Now I have a little cartoon out there. This is from the New York Times that really explains how soap works. And at a very basic level, you know, your germs in particular, for example, the example that we have out here is that of a virus molecule. And what you have really is a molecule that is surrounded by fatty acids and lipids. And because of the very nature of the soap molecules, they're able to actually penetrate and strip away this outside lipid surface, thereby inactivating the virus. Now, what you heard from me is a very boring description of what soap does. So hopefully in the next slide, we have an entertaining video that helps you understand that much better. So could I play the video, please?
The current pandemic of COVID-19 is caused by a new strain of coronavirus, officially known as SARS-CoV-2. This virus is highly contagious and infective. Once the cycle of infection starts, it is propagated through touch and contamination. To break this infection cycle and protect yourself and the people around you, the WHO advocates frequent hand washing with soap in water. The coronavirus has an oily envelope that protects its genetic material. The oily envelope, like grease, helps the virus to stick to your skin. When you wash with soap, the pin-like soap molecules insert themselves into this oily layer, breaking the virus open and inactivating it. Soap also washes off the virus particles, active or inactive, from the skin, just like it washes off grease. But remember, the washing must continue for at least 20 seconds for it to be effective. So, wash your hands often with soap and water. It may protect you and your loved ones from infection and disease.
Thank you. And if we can go to the next slide, please. So soap bars obviously are among the most democratized product in the world. But there are other forms of soap that are also available and that many of you may be familiar with, which is liquid soaps or self-foamers. And where there is no availability of water, you can also use alcohol-based hand sanitizers, typically containing at least 60 to 80% of alcohol. And these will act in a very similar manner in terms of stripping away the virus as well as removing its lipid coat. But just to give you an indication of why soap is just so democratized, I wanted to highlight one of the examples of a soap bar that we sell in India. And this is a 30-gram soap that we sell for rupees 5. Typically, that will give you about 60 to about 100 washes from a single bar of soap. And therefore, that in turn means that you're paying less than about 1 cent or 1 penny per wash. And this is really the heart of trying to prevent infections through such a simple intervention. If you go to the next slide, while obviously soap has come in a sort of a renewed interest on account of the SARS-CoV virus and the COVID infection, I think it's just important to reiterate that soap actually is something that plays a much bigger role in breaking the cycle of infections. There are various moments for hand hygiene, both in a professional setup as well as in a personal setup. And I think it's important that we do not forget the importance of soap in terms of preventing us from all of these other infections as well. So if you go to the next slide, this is really a summary of various studies that have been done which talk about the importance of soap. It's a very sad fact that while we're looking at the number of deaths that are happening on account of the COVID situation, the reality is that diseases like pneumonia and diarrhea still account for a very large number of children death under the age of 5. And hand washing with soap at key moments, particularly after using the toilet and before eating, is known to prevent the infection and the incidence of things like diarrhea by up to 48%, pneumonia by up to 20%, and then a lot of other infections as well. I've highlighted in particular trachoma, which is an eye infection that leads to a loss of sight. And Lifebuoy has been partnering with various institutes to look at how a simple act of soap, hand washing with soap, can help in the prevention of trachoma. So if you go to the next slide, I think this is something that we are immensely proud of. And this is what we talk about as the Lifebuoy's hand washing behavior change program. We're the first brand that has delivered hygiene behavior change at scale over the last 10 years, reaching out to about 1 billion people. And the way we have done it is through partnerships and expertise, which form the backbone of our social mission. Whether it is partners who help us reach the vulnerable, partners who have helped us to create scalable programs and new models, as well as basically partners who have invested in our social mission. And then, of course, examples like these, which have helped promote the entire aspect of hand washing in the form of advocacy. So I'd like to therefore end now with our last slide. And I think there are two parts. The first one, I think that there is a need for us to really drive the agenda and the education. And we're doing this at a very basic level by teaching children the importance that H is for hand washing. And I think I would be very remiss if I did not call out the amazing contributions, the inspiration, and the support that we received through Val for development of our entire hand washing program. So I hope that's helped all of you understand the basic science behind soap. And thank you so much for this opportunity to talk with you.
Thank you, Biphav. The physical chemical processes behind washing our hands with soap are truly amazing. Not surprisingly, current research is demonstrating the great effectiveness of hand washing in removing the virus behind the current pandemic. Our next speaker is Alicia Cray, who is a postdoctoral fellow at Emory University. Alicia will be sharing with us some of the modeling results for different approaches to reduce the spread of the COVID-19 pandemic. Alicia?
Sorry, I was muted. Thanks for that introduction, Ron. So today I'm going to share some results from some work that we've been doing looking at the impact of hand washing on SARS-CoV-2 transmission. So if you could move ahead to the next slide, that'll provide a good framework for my talk. So we know that COVID can be transmitted in a couple of different ways. So in general, there's three main ways. The first way is that whenever you're within 6 feet of an infected person, droplet transmission can occur. So that's when someone maybe coughs or sneezes, or even just speaking, the particles might land directly on you, and that's what we call droplet transmission. Second, you can have direct contact between an infected and a susceptible person, which could lead to transmission, and that's the just direct contact pathway here. And then the third way is transmission that can occur via surfaces, which is called fomite transmission. And that can happen when inanimate objects become contaminated with pathogen. And so then if a susceptible person touches a surface that has been contaminated with pathogen and afterwards touch their face, transmission can occur. So for my presentation today, I'm going to be focusing on fomite transmission because it is the transmission pathway that directly depends on hands for transmission. And that's also where hand washing can have the biggest impact. So if you can move to the next slide. So for the fomite transmission pathway, an infected person can expel virus directly onto a surface or onto their hands and then touch a surface, leading to surface or fomite contamination. A susceptible person can then become infected when they touch the surface and then touch their face or other sites of infection. And so you might notice here that there's no way for pathogen to get from this infected person to the susceptible person without hands for this pathway. And so that suggests a possible role for hand washing. So transmission from surfaces can be reduced by 3 general interventions, and I'm going to be talking about them together. The first is mask wearing, which can reduce the amount of virus shed onto surfaces and also the rate at which self-inoculation can occur. Second, you can have surface disinfection, which removes pathogen from contaminated surfaces. And third, which is the focus here, is hand washing, which can remove pathogens from hands. And so to study the impact of these 3 interventions, I'm using a transmission model. It's a compartmental type of model. And in this model, I'm going to assume that surface disinfection and hand washing are 100% effective. So they remove all pathogens present on the surface or on hands at that given point in time. And so their overall impact on transmission is going to be determined by how frequently we do these interventions. So the next slide, please. So these interventions could impact COVID transmission by either 1, reducing disease severity, which would lower the exposure dose, or secondly, by preventing transmission, which could happen if they bring the basic reproduction number below 1. So the basic reproduction number generally refers to the number of people an average infection generates during that person's infectious period. So if each infectious case infects less than 1 person on average, the outbreak will generally die out. So my talk will be divided into first talking about the reduction of disease severity, and then second talking about how hand washing could help prevent transmission. So if you go to the next slide, please. So first, I'm going to talk about how hand washing might impact the severity of COVID. So in this plot, for each of these panels, the y-axis shows the amount of virus on a susceptible person's hands, as that reflects the dose of pathogen an individual would receive if they touch their face with contaminated hands. And that was their primary route of infection. The x-axis shows time, so the plots show the amount of pathogen a person might be exposed to over time. And here for these simulations, I'm assuming no mask wearing, and I'm considering how different frequencies of surface disinfection and hand washing could impact pathogen load. So the different colors show the different frequencies of surface disinfection, and the different line types show the frequency of hand washing. And what we can see here is that for each level of surface cleaning, hand washing can significantly reduce the amount of pathogen an individual is exposed to and thereby flatten the curve. So more frequent hand washing could reduce the exposure to pathogens from hands. And so the panels are for different settings. So we looked at these trends across different settings, comparing daycares, offices, and schools. We found that the impact of surface disinfection and hand washing was very similar for all 3 settings. So let's move to the next slide. So this result for reduction in exposure is important because reducing viral exposure dose could also reduce the severity of COVID. Unlike enteric pathogens, where increasing dose predominantly tends to influence whether or not you become infected and not necessarily how severely infected you become or how sick you are. For COVID, it seems like higher doses of pathogen might actually influence the clinical course of disease. So in this graph here on this slide, I'm showing data from a paper that was recently published of the impact of non-pharmaceutical interventions on disease severity. And in that paper, they compared the fraction of cases that were symptomatic as a function of social distancing intensity. So in general, having non-pharmaceutical interventions for all different measures combined should reduce the inoculum of virus an individual is exposed to. And in that study, they found that populations in which social distancing had begun prior to the first case, all infections that occurred were ultimately asymptomatic. So that's this solid red bar here. We don't see any symptomatic infections in that particular subpopulation. In contrast, in populations for which social distancing did not start until the first cases had been reported, and thus participants could have been exposed to a higher viral load, about 30% of all infections were asymptomatic. So this result implies that hand washing could reduce the risk of severe COVID by lowering the exposure dose, being one part of a combined intervention strategy. Let's move to the next slide. And so now I've shown that hand washing can reduce the risk of severe disease. And so now I'm going to talk about hand washing, how it might be able to prevent transmission. So in this example, in this slide here, I'm assuming that participants are wearing face masks, which serve to reduce the shedding rate and also the rate at which participants infect themselves by touching their face. So on top of mask wearing, I am investigating how surface disinfection and hand washing could help bring the basic reproduction number below 1, which would stop onward transmission. And so the x-axis for each plot is the proportion of surfaces that are likely to be contaminated in a given venue based on how individuals in a given setting interact with their environment. So the y-axis is the rate at which people in these venues touch surfaces. And you might imagine that in a school or daycare, kids are crawling all over the floor and touching everything very frequently. And so that type of setting would expect it to be really high for both the fraction of surfaces that are accessible and the rate of fomite touching. So it would be in the top right corner of each plot. In contrast, in an office setting, people are more confined to their desks and probably touch the surfaces around them less frequently. So an office setting would be represented by the bottom left of each plot. So the red colors in each of these plots indicates a situation where transmission is unlikely to be prevented by mask wearing, surface disinfection, and hand washing, even when we do all three together. But the blue colors indicate that those interventions combined have successfully controlled onward transmission. The light blue indicates control through surface disinfection and mask wearing alone without any hand washing, whereas the darker blue indicates a situation where transmission would be expected to continue with just cleaning the surfaces, but that adding hourly hand washing could interrupt transmission. So here we see that in some settings, particularly in low-risk settings like offices, including hourly hand washing as a part of a control strategy can help prevent onward transmission. And that's particularly true when it's combined with surface disinfection and mask wearing. So next slide, please. So the results I've shown here are for COVID specifically, but I just want to conclude by pointing out that the broad infection control strategies that have been implemented for COVID have already impacted the incidence of other pathogens. So this plot is for norovirus, and one project that my colleagues and I have been working on is looking at how all non-pharmaceutical interventions combined in the United States, including hand washing, have impacted the influence of norovirus. And we can see here that we might have expected some decline in outbreaks going into the summer months, but what we've seen already is far greater than we would have expected based on seasonality alone. And the analysis we've done has shown that this cannot really be explained by underreporting either. And I know some of my colleagues that have been working on flu, which I'm not going to show any slides for that, but they found similar things. And so if we continue the enhanced hand washing we've been seeing as a part of COVID, we might expect that some of these benefits for other pathogens would be able to continue beyond, just like my colleague talked about with hand washing for these other diarrheal diseases. And so just in summary, the last slide, please. Hand washing can prevent transmission when it's combined with other interventions, including mask wearing and surface decontamination. But even when it doesn't prevent transmission from surfaces, it can reduce the severity of disease. And if sustained, overall improved hand washing could influence other pathogens beyond coronavirus. So thank you. That's the end of my talk.
Thank you, Alicia. Our presentations are pointing out that hand washing is so important for so many different health and development goals. And just like those many development and health goals, hand washing needs to be integrated with other approaches to achieve the optimal impact. Where these goals are reducing the spread of respiratory disease or reducing absenteeism in school, hand washing has a critical role to play there, and important to integrate hand washing into overall programming. Our next speaker is Sarah Beale, who is a researcher at the University College London. Sarah will share research of the impact of hand washing on the spread of seasonal coronavirus in the community. Sarah, over to you.
So I'm going to move kind of the talks from the theory behind how hand washing works and why it might influence coronaviruses in a positive way, to a bit of evidence from field settings. Could I have the next slide, please? So as Ron mentioned, hand hygiene has received kind of unprecedented coverage in public health programs to prevent the spread of coronavirus during the current pandemic, as you can see from these lovely multilingual public health government posters. So there's a very solid science, as you've heard, from behind why hand washing with soap and water is likely to disrupt coronavirus transmission and the kind of situations where it would be particularly helpful. However, sometimes the scientific theory behind how things work doesn't necessarily translate as neatly as you might expect to results in the field. So it's quite important to look in community settings as to how much hand hygiene reduces the observed risk of different infections. This is quite an under-researched topic for many respiratory infections, so acute respiratory infections like influenza or coronaviruses. So prior to the current pandemic, virtually all of the evidence around reduction of acute respiratory infection was for influenza and found a small but substantial effect of hand washing on preventing new infections in kind of a given epidemic season. However, prior to this year, there was not a specific study in community settings outside of trials on reduction for coronavirus infections. I could have the next slide. So we set out to look at whether hand washing frequency predicted the risk of seasonal coronavirus infections in community settings in a given winter season. Next slide. To do this, we used data from a large UK prospective cohort study called the Flu Watch study. So this was run over several winter flu seasons. And the basic setup of the study was at baseline, participants who were recruited from all over the UK in households provided information, kind of both demographic information and information about their hand hygiene practices. So the information that we used for this study was they estimated how many times in the previous day they had washed their hands. And we categorized this based on the literature into kind of low frequency hand washing, which was less than 5 times a day, moderate, which was 6 to 10 times a day, and high frequency hand washing, which is people who wash their hands more than 10 times. We then followed up these households over several winter flu seasons, and all participants provided weekly diaries reporting any symptoms of illness. And if they had respiratory symptoms for more than 2 days, they swabbed themselves, and these swabs were tested for a panel of different viruses. So these were, of course, tested for flu, but they also happened to be tested for 3 human coronaviruses, which are reported on the screen. So these 3 viruses have a similar structure to SARS-CoV-2 that causes COVID-19, meaning that they're susceptible to hand washing in the same way. And they're also spread through similar transmission mechanisms. So they're a useful proxy for understanding hand hygiene's impact on SARS-CoV-2. If I could have the next slide. So to actually quantify the impact of hand hygiene, we used robust Poisson mixed models to test the exposure of hand hygiene frequency on risk of coronavirus infections within a given coronavirus circulation period. We controlled for age and for healthcare worker status because both of these variables influence how often people tend to wash their hands. So healthcare workers tend to wash their hands more than the general population, children less. And both groups are at a higher risk of just encountering lots of other ill people. So we controlled for these confounders, and we also adjusted for clustering at the household and individual level because some people were followed up over multiple seasons. Next slide. So the sample were largely adult, as you can see. And interestingly, there was a relatively even split across hand hygiene behavior categories. So 26% of participants reported that they washed their hands less than 5 times a day. and 39 and 35% respectively reported moderate or high frequency hand washing. So there was a good kind of chunk of the sample that reported each pattern of behavior. Next slide. So our results indicated that moderate frequency hand washing, so that's hand washing 0 to 10 times a day, was associated with a 36% reduced risk of coronavirus infections within a given season compared to low frequency hand washing. Interestingly, we didn't find any evidence of a dose response effect with an even lower risk for high frequency hand washing. However, as you can see, there were relatively few coronavirus infections within the sample overall. So this was likely led to low power to pick up. So it does look like there's a reduced risk, but we didn't have enough precision to estimate it, whether it was substantial. There was also likely residual confounding by variables such as other professions. So we were able to adjust for people being healthcare workers, but people in other frontline professions, such as cleaning professionals or kind of food service professionals, tend to wash their hands more as well, but may also be exposed to either more infected people or more infected surfaces. And so future research, it would be good to control for these to see if there is a dose response effect of hand washing. Next slide, please. Overall, however, the results do indicate that there is a protective effect of hand washing on reducing the risk of coronavirus infections in community settings. And this was the first community-based study of hand washing on risk of these types of coronavirus infections. So these results are really encouraging in the context of the current pandemic and illustrate that even in a community setting where there's kind of so much going on risk-wise, this does have the potential to reduce transmission in a meaningful way. And it really highlights how important it is to promote hand washing as an intervention, both during the current pandemic and, as the previous speakers mentioned, beyond, both for respiratory illnesses and for the many other kind of viral and bacterial illnesses that they can prevent. Thank you very much.
Thank you, Sarah. Really fascinating to see the actual results of hand washing with seasonal coronavirus and preventing the spread. We will be going to questions and answers for our presenters now. For you to ask questions, please go to the link in the chat box. That'll take you back. That's a pathable link. And when you get to the Pathable page, please enter your question in the poll feature. Again, you go to the link that's in the chat box, and then that will take you to the Pathable page where there's the poll feature where you can enter your question. So please go ahead and enter your questions there. And we'll have the presenters answer them for you. And just again, these are amazing presentations. I mean, every time I hear the description of the physical chemical processes of soap, I find that fascinating. But then to see the modeling of the effects of hand washing can have on the current pandemic to prevent the spread of COVID-19, again, that was fascinating. And seeing the integral part that hand washing is part of that solution, not the whole solution, but such an integral part of that. And then to see the effects of hand washing to limit the spread of seasonal coronavirus a few years ago. Again, all this has been fascinating presentations. So Vibhav, we have a bit of a question, a bit of a housekeeping question here. The question for you is the video available? Can we make that available at our website?
Yes, I think the video is part of our main deck. So therefore, it is very much available, and we'd be happy to make that sort of sharing on the website as well.
Okay, very good. So again, the slide deck is available at the page for this site event. And if you have issues downloading any of the materials there, then please just contact us at the Global Handwashing Partnership website. Any other questions for our presenters today? I know it's a bit of a, there's a lot of, with having two different pages here, there's a lot of different things to be able to ask a question. Here we have a question for Alicia. With your model, you assumed 100% effectiveness of disinfection and hand washing. Curious if there's research in the likely effectiveness in those in real settings.
I'm not sure about in real settings. I do know that for the surface disinfection, we found that there's some data that was experimental studies, but not in the lab, that did suggest that a lot of commonly available disinfectants were very effective, over 90%. And so it didn't seem like it made sense to vary the efficacy for surface disinfection. I'm not as sure about hand washing. I know that there was some discussion with our CDC colleagues about trying different parameter values for that. And that's definitely something that we could try. It would be good for me to review and see if there are any new studies that show the different effectiveness of different methods for hand washing. So.
Okay, thank you. And Sarah, here's a question for you. Were you able to control for or address the high possibility of people overestimating the number of times they wash their hands due to self-reporting?
So that's actually a great question. And I think any self-report variable is liable to be affected by those kind of recall biases. It's really difficult, I think, from a behavioral perspective to estimate the degree to which that may have impacted it. But we had a few things kind of going in our favor in this study in FluWatch. So people were reporting this pseudonymously, and it was via a computer. So I think when it's reported to another human on the phone, people tend to be more likely to report desired behavior. And we did think about this, but the quite high proportion of people who reported low frequency hand washing would indicate that there does seem to be a good chunk of people who were comfortable reporting what was likely to be kind of an accurate frequency. But I agree completely that this may have been an issue, but it's very difficult in general unless you follow people and observe them to estimate the degree to which that may have impacted results.
Okay, thank you, Sarah. So our next question, it's not directed to any one of our presenters, so I'll open it up to any of you that would like to respond. After hand washing, most people need to turn off their water tap with their hand that they've just washed. So what are the risks of recontamination by doing this, especially in public spaces? Would anybody care to address that question? I know that's always a difficult issue. Vivav, would you have a response on that?
So I don't think there's an easy response to that because the reality is that it's very hard to look at how do you control what might be actually sitting on the tap. There are ways to do that in terms of, at least certainly if you're in a public restroom, if you can use a tissue to do that, or where possible, there are ways by which you can use your elbow or something else to turn off the tap. But unfortunately, I don't think there is an easy answer for this. I suppose if there are any thoughts that any of the attendees have on this one, any suggestions, we would be very happy to hear about them.
I did want to add that I know that the virus does not live very well on cloth surfaces or on porous surfaces. So in that respect, using something like a tissue could be very effective, or even just using your shirt or some other cloth surface, because the virus isn't likely to persist on that and then for you to be reinfected afterwards. So that's, I think, something that would work very well for COVID.
Thank you. That's good to know. And of course, it's always a challenge during any times to prevent the spread of any disease when we're washing our hands, but then we have to turn off the water. But I find myself having to be creative with that, with the back of my hand or my elbow or a paper towel. Or some way to prevent recontamination. And now we have a question for Vibhav, which actually comes from a statement that we heard during the opening plenary. I'm glad this question came in because I was getting texts about this during the opening plenary. So Dr. Weber said during the opening plenary that hand washing does not kill the SARS-CoV-2 using soap and water for hand washing. But Vibhav, you did say that soap and water can disrupt the virus's lipid layer and then inactivate it. What is the relative contribution of these two mechanisms to hand washing's overall effect on exposure? The comment is, this is an important piece of information for evaluations of other hand washing techniques and products. Vibhav?
Yeah, so I don't think that at this point, we would be in a position to make a comment about saying what percentage, of the efficacy of hand wash comes in on account of inactivation, and what percentage of it actually comes because of washing away and removal of the virus particles from the hand. And it's also not very clear whether the process of inactivation, the process of some of the lipid dissolution, etc., actually contributes to much faster removal of the virus from the surface of the hand itself. And I think this is probably the area where we would need to do a lot more research. Also in terms of therefore understanding that if there are any particular surfactants, combination of surfactants, etc., that actually do this much better than others. In the absence of that right now, I think the evidence that is available, and we go by a lot of expert recommendations as well, is that the process of hand washing with a soap or a surfactant, or rubbing the hands using the appropriate level of alcohol, does have evidence that it can actually disrupt the binding of the virus to the hand and also potentially disrupt the structure of the virus itself. Yeah.
Okay, thank you. That's a great explanation. And Sarah, we have a question for you about if you could explain a little bit more, comparing the results for moderate frequency washes and high frequency hand washing.
Yeah, of course. So for moderate frequency hand washing, we found this risk reduction per coronavirus circulation season of 36%. And we found a corresponding effect. And so this was significant, meaning that the confidence intervals for the estimate didn't cross one. And so we were able to precisely kind of measure this enough to come to a fairly firm conclusion that this was a significant effect. In terms of high frequency hand washing, so we did find a corresponding effect in the same reduction. So there was a risk reduction. However, the confidence intervals for this crossed one. And And this was, as I mentioned, this was likely due to low power and residual confounding, so variables that we weren't able to control because there just weren't enough infections for us to have been able to kind of adequately open that down. So it does look like the risk is lower with high frequency hand washing, but we weren't able to get kind of a precise enough estimate in our model to kind of generate a significant effect. But the direction of the effect was indicating reduced risk. Hopefully that clears things up.
Thank you, Sarah. That's a great explanation. So one of the, we've had a follow-up question to the earlier discussion about a hand washing facility and having to turn off the tap with your hand. The comment was about if there could be a foot pedal, then that is a effective way to reduce that recontamination in especially in a public setting for hand washing. And then Vibhav, we had another question for you. If you can comment on the possible source of recontamination of solid soap. So again, if you're at home or especially in a public setting and there's solid soap there and you're using that to wash your hands, what's the possibility of having contamination from the soap?
Look, I think the studies that we have seen, including some of the studies that we have done, does not seem to indicate that there is any significant residual contamination of soap that happens, unless and until, of course, you've got a very, very high load of contamination, and the person following you is literally using that soap within seconds of you having smeared it, literally, with a ton of germs. And therefore, I think the benefits of using a soap, especially when the soap is washed and put back on the surface, is virtually minimal. And it's one of those things where I think we have to look at the benefits of proper lathering, which is the reason why I think the importance of adequate lathering, the importance of adequately covering your hands and making sure every part of it is rubbed and scrubbed well, in terms of being able to dislodge any germs that are present on the surface. All of those things are absolutely critical. And I think more and more evidence, including studies that have been done in villages with very high levels of diarrhea and other kinds of infections and all, have demonstrated that the use of soap can significantly bring down the incidence of disease. So the benefits of actually using soap under these circumstances is quite proven.
Thank you. That's a great explanation. We had another question come in about what about rural villages where how do we get soap into rural villages? And what we have seen is generally when people go to the market town, then there is some kind of soap available there. Sometimes we're asked the question of what's the best kind of soap to use, and what we found is that usually people have some kind of soap in their household, and so people should use the soap that they have. They should use the soap that's available to them. Certainly, if there's a situation where the supply chain of soap is an issue, then there could be programs for making soap locally, or if there's just a problem with soap altogether, then there's the possibility of using ash as a replacement for soap. But certainly we want people to utilize the kind of soap that they have in their household. And we are going to have to end our questions to our presenters here because we do have a panel to move on to. But I'd like to thank all three of our presenters, Vibhav, Sarah, and Alicia. Great presentations, and just loved hearing about these studies and back to the basics of hand washing with soap. And with our panel, I would like to say that we will be taking questions for our panelists. We'll have some questions we have for them, but then we'll also be taking questions from you. So please go ahead and as you have questions, if you can enter those. So we are also transitioning. So in our presentations, we were talking about why soap, hand washing with soap is important with COVID-19 as well as with other health issues and diseases. Now we're going to be transitioning to a panel where we'll be talking about how to do good hand washing programs so that those programs are effective for increasing hand washing during this pandemic, but also that those hand washing practices are long lasting and will last long after the pandemic is over. So today's panel includes Na Nguyen, and she's a senior WASH and SBC advisor at USAID. We also have Julia Rosenbaum, who's a senior technical advisor for WASH behavior change at FHI 360. Dr. Robert Drabelbeis is joining us, and he's an associate professor at the London School of Hygiene and Tropical Medicine, and also the director of the COVID-19 Hygiene Hub. And we also are glad to have Mr. Tazim Qayyum, a regional coordinator for the 2030 Water Resources Group, which is hosted by the World Bank. And so I'll be moving forward with questions, but again, for the questions you have, if you can enter them in the poll feature at the Pathable site. And I'll start with you, Julia. And this is really part of the heart of the whole question I have for the panel. Can you walk us through some of the considerations of designing a hand washing behavior change program that will be effective during COVID-19 and also produce long-lasting hand washing practices? Julia?
Sure. Thank you, Ron. And that's a big question. And this is a Q&A section, so we could take the whole time slot just handling that, but I'll get us started and let others fill in. So the question first gives me a chance to plug the Global Hand Washing Partnership's just released Hand Washing Handbook, where we provide all kinds of really useful guidance. There's a chapter specifically on designing hand washing programs, and we'll post that link in the chat for folks to access. The handbook also lists a lot of other great resources, including the COVID Hygiene Hub that you mentioned that Robert is director. So starting to outline some considerations of designing a behavior change program, whether it's under COVID conditions or under other times, the handbook really breaks down program planning into 3 key decisions. And we suggest that that would apply to almost any situation and even beyond hand hygiene. But the 3 decisions, the first one just really simply would be, who's your audience and what do you want them to do? And it's just critical to be very specific in your ask. The second decision that we guide people to do is then what influences that audience's behavior. And it would be very specific, of course, to the behavior and the audience. And then lastly, what activities would address those factors, those behavioral determinants. And in doing that, you're really laying out what would be a theory or a hypothesis of change. So the first sort of consideration and guidance is we urge you to be very systematic. And across all kinds of theories and frameworks out there, it basically, those 3 questions become common denominators. So your audience and behavior, the determinants, and then what activities would get that. As far as which one, which theory and which frameworks, I'm somewhat agnostic, but I just say, choose one and use one. Because you specifically asked about planning programs under COVID, I just add that, of course, under COVID, it's an epidemic, it's urgent. And so please, don't start from scratch. There's a lot out there already that we know about what works best, about what influences behavior, specifically hand hygiene behavior. So please do consult literature reviews, Google, be discerning, of course, of your Google sources, but Google and read what other projects and programs have done and what's worked. What have we learned already? So that would be some of my general terms, but I really do turn to some of my colleagues to add to that, please. Over.
So, same question over to you. What are some other considerations for designing a hand washing behavior change program that will be effective during COVID-19 and also provide a long-lasting hand washing practices in the future?
Great. So in addition to what Julia has said, because of the COVID-19 pandemic, awareness of hand washing with soap is very high, right? It was the first behavior that everybody talked about in preventing COVID-19. But we actually also have indication that social norms may also be shifting. And in fact, the USAID Wash Pals project recently completed a rapid assessment on trend analysis of COVID-19 effects on a handful of countries, including the DRC, Ghana, Kenya, Mozambique, Nepal, to name a few. And what they found is that 84% of respondents said that they had seen their neighbors and friends hand washing with soap more frequently. So it's important that this is not self-reporting in that this is what I do, because we have mentioned, somebody mentioned the bias, but it's what others, what you notice others are doing. So for me, given this, we know we need to give more focus on how to maintain hand washing rather than focusing on the why do we need hand washing and the need for hand washing with soap. And I think that I will sort of save the question on the actual how for our panelists later, because we have Julia and Robert who are going to go into that in a little bit more detail. Thanks, Ron.
Okay, thank you, Na. And my next question is for Robert. And Robert, at the London School, you've developed the COVID-19 Hygiene Hub. Can you discuss the Hygiene Hub in a little bit of detail here and explain how it can be leveraged as a resource for those designing and implementing hand washing programs?
Yeah, thanks, Ron, and just just to kind of discuss a little bit about the Hygiene Hub. We are very much based at the London School of Hygiene and Tropical Medicine, so LSHTM, but I think that we're deliberately referring to this as housed at LSHTM. We have a broad network of organizations that we partner with and that we bring in on kind of various capacities. Overall, the COVID-19 Hygiene Hub is really designed to provide any kind of technical support around hygiene programming for COVID-19 prevention. And we do this in multiple ways. One is kind of preparing resource documents. So building off some early webinars, kind of right at the launch of COVID-19, really understanding kind of what some of the key questions were for implementing organizations around hand hygiene and hand hygiene programming. And with this, we've kind of built out a repository. It's all built in kind of simple FAQ style questions, but now we have over 200 resources about various aspects of hygiene programming as it relates to COVID-19, everything from just general program design to M&E strategies to the efficacy of specific interventions, and including other key COVID-19 interventions as well. So we have resources available on mask wearing, we have resources available on social distancing, how to do programming under social distancing conditions. So we kind of have a whole range of those. We also have an online portal that anyone can go to and enter in information or ask questions. We have a team of technical advisors kind of waiting on standby. And I think a third part here is also a position of sharing what we find working or innovative solutions. I think kind of one of the things that, as everyone has mentioned here, kind of programming around hand hygiene has kicked into overdrive with COVID-19. The research on COVID-19 is kicked into overdrive. So part of what we're doing is helping distill emerging research around hand hygiene, turning that into practical actions, but also working with partners to identify innovative solutions and amplifying those, sharing those. So we have an entire kind of section of case studies of interesting approaches to COVID-19, many of which are around hand hygiene or include a very kind of specific hand hygiene element. So there's various ways. I'll put our website into the chat, but you can engage with the website. There's a broad team, again, many of us at LSHTM, but a broad network of global partners who are really contributing to this overall effort.
Thank you, Robert. Now, Tanzim, I actually have a couple of questions I wanted to ask you. First, can you discuss the approach that you use to develop hand hygiene initiatives and support the pandemic response in Bangladesh? And the second question is related to that, and that is, so how does that differ in the context of COVID-19? Tanzim?
Yeah, no, thanks, Ron. And also nice segue from Robert's point on partnerships. So 2030 Water Resources Group creates partnerships at the country level, including in Bangladesh with the public sector, high-level policymakers, industry champions, civil society leads, and development community. So we have a holistic approach to water management, and we normally focus on water governance, efficiency, and pollution, and look at the wash and hygiene sector under that lens. The pandemic has been actually the primary driver for us to shift our attention to hand hygiene, hand washing initiative particularly. And we were one of the early movers in Bangladesh. Back in April, we supported the first, one of the first multi-stakeholder partnerships in the area with the DG Health, Director General of Health, Unilever, and also Bangladesh Red Crescent Society. That initiative was about setting up 64 hand washing stations in the 64 district commissioner's office, and also communications and behavioral change campaign targeting about 20 million people. So that initial intervention set the stage for further partnerships. We are at the moment implementing a second initiative with the Dhaka South City Corporation in partnership with UNDP, Unilever, and HSBC, focusing on basically sanitation workers, 5,300 sanitation workers, which is a vulnerable group in this pandemic, and also a potential spreader of the virus. Our third initiative is being planned, and I'll probably touch upon that a bit later. In all the initiatives, our strategy is to include a coordinated development and policy, coordinated development of policy and public messaging between the government and the private sector, installation of wash infrastructure, and this design and implementation of communications and behavioral change campaigns. Our focus is on doing the convening, providing the platform for the convening, and support the concept generation and resource mobilization, and the execution happens through partners.
Okay, thank you very much. Appreciate that response. And just to remind everybody, we are taking questions for the panel. Again, go to the link back to the Pathable site and use the poll feature to enter any questions there. And we do have a question from the audience, and this is directed to Robert. So has there been a study that looks into behavior change and communications efforts under the COVID response? What % actually wash their hands for the recommended 20 seconds or more? Robert?
Hi, I think, understanding exactly what we know specific to COVID-19, I haven't seen anything. That doesn't mean it doesn't exist. I will point out that the number of studies, if you do, there's a new PubMed feature, if you go to PubMed, that's tracking just articles around COVID-19. And last time I looked, I think it was about 20,000 that have been produced over kind of such a short period of time. The extent to which the percentage of people that are tracking or that are kind of following the recommended procedures of washing their hands for 20 seconds, I think that's kind of data that I'm not sure we'll ever really know to that level of precision. I know that CCP at the Center for Communications Program at Johns Hopkins has a global dashboard that they're using, looking at the percentage of respondents who do report increasing their hand washing over time in response to COVID-19. Those numbers have gone up, but the extent to which kind of specific individuals are washing hands for 20 seconds or more, I would even be hard pressed to know if I'm doing that. And I know enough about hand washing that I get invited to talk about it. So, you know, I think that level of precision may just never be available. So.
Thank you, Robert, and thank you for that honesty and transparency. Be a good question for any of us on how long we wash our hands. And so this question, anyone in the panel that would like to answer this, if you could just raise your hand. So how has hand washing promotion strategy been adapted to the fact that people are spending more time away from public spaces because of the pandemic? More people are spending time at home. So has there been adaptations in hand washing programming? Julia?
Just to start us off, and then please others jump in, but the first thing that strikes me, of course, is that the junctures have changed, the times. Whether it's 5 or 6, in different countries have different sort of recommended times, but they were fairly prescribed around after defecation and before cooking and feeding. And now that we are at home more, as the questioner was asking, but also because of COVID conditions, we've added new junctions, particularly when we come into the house. So that was never there before. Usually it's before touching or caring for an elder or anyone in the house, so before reaching out to anyone. So we've added these new times. And like I was saying in my first response, when you have a new behavior, you may have a whole nother set of determinants. We know, for instance, that using disgust can work well for motivating hand washing after defecation, and nurture can really trigger hand washing before feeding a child. We're just learning, if you will, what's going to trigger hand washing when you're coming in the door, when you're doing those other times. And so that's some of how it's changing and how we have to learn. And as I said earlier, we can't start lengthy research activities now, but we can at least concept test and try and confirm what determinants, what factors seem to influence at these new times. But I would say that's a particular one. I invite my other panelists. Anything else strike you of sort of COVID particular when we think that the setting has changed? Because we know that the setting is really key to designing a behavior change activity.
Yes, Robert, go ahead.
I would just add, I think, we've got to remember that I'm not sure who all is in the room. I've looked at the attendee list, and I know there are quite a number of experts on hygiene and hygiene behavior change and hand washing, but really understanding that kind of what we think of as kind of the standard strategies. So those based on peer effects, like I would say one thing we've seen quite pronounced in the initial response is that those were not the strategies that people have used around COVID-19 and hygiene during COVID-19. We kind of initially defaulted to a lot of health-based messaging around kind of why this is important, what COVID-19 is, and how hand washing could potentially play a role. At specific points of time, this can be a very effective way to change behaviors. But one thing that we often say kind of in hygiene promotion or hand washing promotion is that knowledge alone is never going to change behavior. So I think kind of one thing that we've done is, globally in response, and this is based on, an informed comment by our interactions with over 400 organizations quite a number of organizations implementing hygiene programming in response to COVID-19, is that initial responses really did target what we know, kind of health messaging, knowledge-based messaging. And this is just now where people are starting to kind of move beyond those initial health-based messaging and thinking about kind of how we can leverage, or how can we utilize more holistic approaches to hygiene behavior change. Now that some of that initial fear, that initial risk perception has kind of died down a little bit. So those health-based messagings, they're just not as impactful. They're not as salient to us as they were 4 or 5 months ago, when nobody knew what was going on.
That's a great point, Robert. And now I have a question for you. along those lines. I mean, as we are transitioning from the first hysteria about COVID-19 and transitioning more into longer term hand washing, and keeping in mind the presentations from earlier today, talking about the widespread benefits of hand washing. So how can we link hand washing with other sectors? So not just in the health sector, but also with nutrition, education, gender, and equity programming. How do you see as strategies for doing that effectively?
Yeah, I think, Rob, what we need to do is to capitalize on the fact that hand washing is having a moment right now. And I think that really it's really taken COVID to, one, highlight the behavior and the importance, but also I think other sectors take it more seriously and see that it can contribute not only to health outcomes, but also continuity of service provision. It's like a whole series, you know, and ensuring infection prevention control and healthcare facilities. So I think it's, you know, within the wash sector, we need to take it upon ourselves to continue advocating for hand washing, but thinking about how hand washing contributes to other programs. So, you know, and thinking about if you're approaching the maternal child health programs, we need to focus on specific junctures that are relevant for that program. It may not be all the junctures that we would like in a wash program. It could just be about focusing on healthcare facilities. It could be about before breastfeeding, for the nutrition programs. It could be around hand washing before food hygiene, but thinking about what hand washing junctures are relevant for that sector, as opposed to which junctures are important for wash. I think for the gender considerations, you know, I think one learning that I've taken away in working in this area for 15 years is that, you know, we started with this idea that, like, if you would hand wash and prevent diarrhea for your child, you're a model mom. And I think, you know, in hindsight, I think we just put a lot of pressure on caretakers of children under 5 who are tasked with many, many other things. And so I think in thinking about how we position hand washing, we have to be considerate of the fact that we are not blaming or demonizing caretakers if they're not hand washing, and ultimately saying, well, it's not enough what you're doing for your child now. You must consistently hand wash in order to become sort of that ideal mom. And so I think just thinking about how we position hand washing and thinking about the specific junctures will help us to make the case for integration with other sectors. Thanks.
Thank you. And that's actually one answer to one of the questions that just came in from the audience. Let me open this up to our other panelists as well. So the pandemic has made us realize the gravity of hand washing and therefore pushed hand washing programming into overdrive. How do you plan to use this as an opportunity to make sure that hand washing doesn't die down in a post-COVID world? And this, of course, is something that all of us are discussing frequently. Who would like to give a first response to that? Tanzim, go ahead.
Maybe I can start. One is to have it anchored with the clear policy directives. And secondly is that countries have medium to longer term plans. One of the country I'm working is in Bangladesh, and that one has a 5-year plan. So anything that gets into a 5-year plan has a decent chance of surviving across changes in government or investment cycles. So maybe this is a start.
That's a great answer. You know, we continue to talk about roadmaps for hand washing at the country level, and for every country to be doing that. So that's a great thing to remind us of. Julia, go ahead.
Maybe this is the time to also just bring up hand washing habit. I know it's something we wanted to make sure that we talked about a little bit on this panel. And I mean, of course, our goal is to make hand washing a habit so that people wash their hands often and correctly without even thinking about it. And so COVID does in some ways prime the pump. Sorry, we make so many water jokes, but it does prime the pump for making hand washing a habit. And when you do have sort of more more actors feeling that urgency to do it now, you've hit a number of the principles of habit formation in the process. So, I mean, again, in talking about habit, the brain scientists tell us that probably about half of what we do is actually habits. It's done habitually rather than with some kind of conscious thought. And if you think about it, it would just be absolutely exhausting to go through our day if we had to consciously contemplate and decide to do all of our actions. I mean, we'd be tired before we even started work in the morning by, you know, I will put one step forward, I will turn on the handle. So, I mean, a few years back, we engaged a brain scientist, we call him, but David Neal, who's participated in the conference a few times. And he's affiliated with the Center for Advanced Hindsight at Duke. And we asked him to sort of engage other habit principles to hand washing. And he tried to identify some of the sort of habit forming principles. And again, I'm all about resources. I can paste a related publication into the chat box when we're done. But I mean, one of the sort of, he identified, I said, these 7 habits. One of them is you just want to make hand washing easy. You want to remove all the obstacles, the steps, and the effort. And I think, again, under COVID, we're doing that. Someone mentioned earlier, even now when you walk out on the street, I mean, in my neighborhood, we never used to have sort of hand washing stations at every block. And now the city is maintaining those. So the first thing is to remove the obstacles. And again, the COVID crisis is sort of helping us to make hand washing a habit that way. Another one of the principles is to create different cues to sort of, and we've talked some about that. We could talk more, but under COVID, again, there's all kinds of cues, not just reminders, but actually sort of non-verbal things that tell us it's time to hand wash. Even the way we greet each other now, even though that's not hand washing per se, but the notion that everyone sort of is doing the fist bump or the soccer kick or the namaste, you know, whatever, but those are also creating a different hand washing cues. And that you really are like what they say, that you're fostering procedural memory for doing that. So like having school kids hand wash all the time, practicing hand washing, that's part of what makes hand washing a habit. And I think we're doing that. It's not inadvertent because it's very conscious right now, these efforts. But what's inadvertent is that we're actually touching on a number of those principles of hand washing habit that will then take us from doing a very short term sort of urgent action to something that we hope is maintained over time. So I give that, and then maybe as a slow pitch to one of my other panelists, I think that the danger is you also have message fatigue, and that works against some of the hand washing habits that sort of people hear so much, and we're seeing that already, certainly with mask wearing, and I think some with hand washing. But there's, if you will, the pro and con. We may actually be you know, finishing on that, priming the pump for better hand washing when we're not in our COVID crisis. But we may have some fatigue, like, oh, enough already.
Well, and so that creates another question for us. And Robert, I'm going to direct that one to you. And if you could address how do we in hand washing programs not make it where people get into fatigue of, you know, I'm just sick of washing my hands all of the time. I'm sick of seeing these hand washing messages. I've seen the same message for 4 months. And how do we address that? And again, longer term, how do we create those habits for hand washing? You know, we have this terrible public health tragedy happening, but how do we make it to turn out for good for public health by increasing hand washing in the long run?
Yeah, thanks, Ron. I don't think there's necessarily kind of a textbook of do X, Y, and Z, and we will get new hand washing habits emerging. I think what we do know, important to remember, hand washing existed before COVID-19, and it's going to exist long after. And this isn't a new behavior that's suddenly come on the scene. We've known quite a bit about this for quite some time. And what can we learn from what we know before? So one thing that we often say is that we've got to consider kind of hygiene and hand washing behavior change is a process rather than an event. It's not going to be this one-off moment where suddenly new habits are instilled. And we do need to think about the broad set of determinants that influenced hand hygiene, both prior to COVID-19, during COVID-19, and after COVID-19, when we finally get to that phase. And it's similar to some of the things Julia mentioned earlier. We need to make sure the infrastructure is available. We need to make sure that resources are present at the household, at the locations where we want people to be washing their hands. We can shout all the messaging we want, but without water supply and soap available, hand hygiene messaging is only going to go so far. And I think you hit on another thing in your phrasing of the question, this kind of messaging fatigue. We need to think about our programs as being adaptive, not just adaptive to the situation, but adaptive to our kind of target populations or the people that we're working with. The same messages over and over again are eventually going to kind of die down. We do not even just message fatigue, but it just eventually kind of fades into the background, when people tell you the same thing over and over and over again. And particularly with hand washing, this is also something we're not informing people of a new behavior. People already know hand washing. This isn't something that suddenly just sprung fully formed with COVID-19. These are messages people have even had before. So a lot of our theoretical approaches to hand hygiene will really focus on that key element of surprise and grabbing attention and making sure that your messaging can really resonate with your target, with a population. So there's multiple approaches that we need to take kind of to ensure that habit can even be formed, and that our messaging or our interactions with populations kind of change over time and really make sure that we're engaging people with new information, new approaches.
Of how sticky is this hand washing habit in such pandemics, given past experience from SARS, MERS, etc. And are there any early indications on if it's different now with COVID-19? Who would like to address that? Again, looking at other pandemics such as SARS and MERS, how sticky was the hand washing habit after those? I would say that in general, in pandemics, hand washing goes up. And when the pandemic is over, hand washing goes back down to the baseline. Just in general is what we've seen from studies. Any of our panelists have anything to add to that?
I think specific to hand washing, we have not specific to hand washing, but we do often see kind of in initial points of a pandemic that as risk perceptions change, as kind of those early social norms change, people do adapt their behaviors quite a bit. And I think it's not even kind of after the pandemic, but even during the pandemic. I mean, how many of us are now are finding the social distancing requirements that we're all living under increasingly difficult to adhere to? How many of us kind of, personally, I really don't have problems wearing masks, but how many of us do fight against this need to kind of put on a mask anytime we leave the home or go into a shop or forget that? So I think not just the post-pandemic period, but in something like COVID-19, where we're seeing now, 6-8 months into a pandemic, how can we make things sticky throughout this pandemic as well? We've still got a ways to go before we're in a post-COVID-19 world. So, but we do see generally a rapid spike and a subsequent decline after some of that initial fear response does die down.
Okay, thank you. I have another question from the audience about hand washing behavior is notoriously hard to measure in light of the most reliable measures, such as household observations being no longer safe to conduct. What are other ways programs can effectively measure hand washing behavior during these days? Who'd like to answer that one? never an easy question about measuring hand washing behavior in general, but especially during these days. Well, Robert, you're still large on my screen, so I'm going to turn to you.
Great.
Hear it.
Yeah, I can post a reference here in the chat or onto the discussion board about various methods that we're working with partners on how to measure hand hygiene and hand hygiene behavior change in response to COVID-19. I think even under normal times, this has always been a sticky thing to get at. And we all say, you know, just go do direct observation. Kind of the one thing we can't do under COVID-19 is go into other people's homes, or we shouldn't be doing, depending on where you are. You know, I think a lot of times what we do have to kind of realize is kind of the adaptation is that we might not have always the best measures. You know, we might need to rely on things like self-report or rapid spot checks of do people have infrastructure in their home, but understanding the limitations of these data sources rather than necessarily kind of saying, well, they might not be valid. They're sometimes the best data that we can get right now, and we can get rapidly, and we can get readily, and we can get safely, which is another concern about data collection during this period of time. But we'll post the resources that we have on measuring or how we can potentially kind of look into hygiene programs during this period.
I'm not sure if you just mentioned, Robert, also the just proxies like we're looking at soap sales, which we are seeing spikes, and hand hygiene, hand sanitizer. And again, we don't know that all that soap is going to hand washing, and we know when we know, but absence of actual observation, we have to start thinking about what proxies might be meaningful to add to the mix. You're smiling. Does that mean not necessarily, or?
No, I mean, I think in contexts like this, you know, that these proxy measures, things that we can collect rapidly and readily from households, you know, household proxy measures, community level proxy measures. I think this is really kind of pushing us to be creative in how we can measure some of these things and really understand the limitations of a lot of these data sources.
Yeah.
Hey,
I mean, without jumping off that question, but I think one thing we've been saying in a few of our answers too is that, you know, as behavior change actors, we've lost a number of our techniques, our activities that we can use too, whether it's for measurement or actually reaching people. I mean, we can't do any of the in-person stuff that we know is so effective. And so just not to lose, I think, not to lose something that we've been mentioning different answers to this question is that now also we can't do any of that in-person interpersonal stuff. So we also have to figure out how do we simulate that. You know, we said earlier, we know how important social norms are to triggering and maintaining behaviors, but a lot of that comes through different kinds of interpersonal activities. And now instead we have to figure out how can we do that through mass media or through text messaging or through those distanced techniques that we have, the tactics that we have. And that's a huge change too about doing behavior change promotion under COVID.
Thank you. Thank you, Julia. And I'd like to thank all of our panelists. Unfortunately, we're running out of time for our panel. When I sit down with any of these folks, we can always talk all afternoon about hand washing. And one note I would make on the last question about methods for monitoring and evaluating hand washing practice, the Global Hand Washing Partnership is hosting a Hand Washing Thursday series. So if you have not registered for that series previously, then please go to our website and register for it. Next Thursday, not this week, but next Thursday, we will be having our next installment of that Hand Washing Thursday series. And the topic will be on monitoring and evaluating hand washing programming. So please, please register for that. It should be an exciting topic, and then we'll have other webinars after that, which will cover hand washing in different contexts and integrating hand washing entire programming, addressing hand washing at a systems level. But now we will move on to our last presenter. We'll hear from Yanita Bartel with UNICEF. She's the hygiene specialist in UNICEF's headquarters WASH team. And Yanita has been a core part of the team, which has set up and shaped the Hand Hygiene for All initiative. And she will be presenting the fundamental information about this global initiative. So Yanita, over to you.
Thank you very much, Ron. Thank you very much for having me here, wrap up this session. It's an honor to be presenting on behalf of the Hand Hygiene for All initiative and to be building on this great insight both into the science of hand hygiene and the programming from the presenters and the panel. With this presentation, I'll hopefully respond to some of the questions and wrap up what has been discussed during the panel discussion. Some of the questions around long-term changes, about comprehensive programming, etc. Since March this year, we've seen unprecedented level of efforts and creativity going into hand washing. I think we're all aware of that. Someone said to me last week, in 2020, every day was Global Hand Washing Day. That warmed my heart. So I would like to start this presentation with paying tribute to the immense efforts and the progress that has already been made. So for example, in Iraq, the University of Karbala, in partnership with the Director of Health and UNICEF, have produced alcohol-based hand sanitizer locally. So far, they have supplied 190 healthcare clinics, healthcare facilities, centers, with over 15,000 liters of alcohol-based hand sanitizer at about 1/3 of the usual price of imported hand sanitizer. In Rwanda, the middle picture you might recognize, and you might have seen those pictures. The government built on existing hygiene sub-strategy to quickly distribute and enforce the use of hand washing stations in crowded public places, in front of commercial buildings. This picture is at a bus station here. And then originating in Vietnam, but very quickly spreading around the world, this TikTok dance challenge. Until today, it has been shared over 500,000 times, reaching billions of young TikTok users with the hand washing dance and the hand washing moves. The Hand Hygiene for All initiative builds on this momentum. In the plenary discussion this morning, Kelly and Naylor called today, this year, a once in a generation situation. And so without doubt, this is a unique opportunity to ensure that the gains we have seen in the last few months are sustained in the long run, to institutionalize hand hygiene, to make it a mainstay in public health interventions. That's why UNICEF and WHO launched the Hand Hygiene for All initiative earlier this year. In a sense, this is the sector's collective answer to the question of one of the participants asked earlier: how do we make sure that hand washing does not die down after all the flurry we've seen about it in the last few months? We've seen the need for improving hand washing across multiple settings, including healthcare facilities, schools and homes, but also workplaces, transportation hubs, places of worship, markets, etc. So it's really a multi-sectoral effort, which has already been mentioned a few times. The ultimate purpose of the initiative is to accelerate global action on hand hygiene in support of country-level action. The initiative focuses on country action. The initial focus to start with will be on developing country roadmaps for hand hygiene that bridge between the national COVID-19 response and longer-term development goals. And finally, through this global initiative, UNICEF and WHO bring together a group of core partners around a shared vision, and we're working collaboratively, involving really the whole of society, with key international organizations, national and local governments, development banks, NGOs, entrepreneurs, employers, civil society, academic partners, and so on. You can see the logos of the core partners at the bottom of this slide. What does it take to move the needle? So we've already heard quite a bit on that in the last sort of half an hour, 45 minutes. As Robert said, and a few other panelists underlined, we're now moving into a time when we need a more holistic approach for long-term hand washing programming. There might be a messaging fatigue, and really, like we need to think long-term now. So across the board, we've seen some common elements of successful hand hygiene programming, and as I just mentioned, one of the first milestones for the Hand Hygiene for All initiative will be for countries to develop country roadmaps along those elements. So the first element is a hardware element. On the bottom right hand side, adequate and equitable access to hygiene products and services. I'm actually surprised that nobody has mentioned these numbers until now. 3 billion people that don't have a place to wash their hands, 118 million school children, and 1 in 3 healthcare facilities. That is really, we need to have an easy and fun place to wash our hands, make performing the behavior easy. Second, access to products and services is not enough, and we've discussed that at length. So building behavior change programmings on behavior change frameworks, addressing key barriers to performing a behavior is key for making hand hygiene, improving hand hygiene. And then the third element, which we have talked less about, is a strong enabling environment. So we need the right policies, the right strategies, financing mechanisms, monitoring to sustain the advances in the long run. So we're building on the SWA building blocks. But yeah, this is like, and these 3 elements, as you can see, so the arrows indicate these 3 elements are interdependent of one another, so one can't go without the other. And all 3 are embedded in strong political leadership at all levels. So global, national, and local level need to champion hand hygiene to move the needle. You may have heard of the SDG 6 Global Acceleration Framework, recently launched by UN Water. We're using this framework and its 5 accelerators to illustrate how the global initiative can support country efforts. So just briefly running through those 5. First, optimized financing starts with an agreed costed plan for hand hygiene. Second, we need to fill the hygiene data and information gaps in schools, healthcare facilities, but also in other settings. We're working with the JMP team, the Joint Monitoring Program team, led by UNICEF and WHO, to put together a high quality tool for hand hygiene in public places at the moment. Third is capacity development, which ensures we will have the right people with the right skills to actually make these plans a reality, put them into practice. Fourth, we've seen a lot of innovations on hand hygiene flourish during the pandemic. We need to help accelerate the adoption of these innovations by improving the mechanisms for learning and exchange. And fifth, governance. We need clear roles within the sector. We need multi-sectoral involvement, and we need inclusive institutions to ensure multi-stakeholder involvement to make sure hand hygiene is everyone's business. Substantial, long-lasting improvements in hand hygiene, and I think we know this all, won't happen overnight. It's a long-term process that requires strong political leadership and multi-sectoral engagement. We think about this, the time ahead of us in 3 phases. The first is the response phase, where the focus is on controlling the outbreak. The rebuild phase, focusing on relaxing restrictions while ensuring health and safety for everyone. And then the reimagining phase, where we have a strong enabling environment to sustain a culture of hand hygiene. The Hand Hygiene for All initiative is calling for countries to start now to develop country roadmaps that build on their specific strengths and fill critical needs to bridge these 3 phases, connecting the COVID-19 response with the longer-term development goals, building long-lasting habits. Now, what could those activities that bridge between now and the future look like? Again, I brought 3 examples for you. The first one from Cambodia. The government of Cambodia has recently equipped 13,000 schools and 3,000 community-based preschools with hand washing facilities, achieving 100% of hygiene in schools coverage. Now working towards putting the right mechanisms in place to sustain this infrastructure and keeping hand hygiene supplies available. On Global Handwashing Day, a multi-sectoral policy brief on hand hygiene was presented in the Parliament of Mozambique. Here you see the Prime Minister of the country washing his hands before entering into parliamentary session. The policy brief was a strong multi-sectoral anchor and calls among others to improve the capacity for hygiene programming, norms and standards for hygiene, and to develop a national hygiene campaign. And then in Bangladesh, they're already, in a sense, one step ahead. They're building on existing nationwide campaigns, such as the National Sanitation Month in October every year. A multi-sectoral working group under the leadership of the government is currently mapping out details to mapping out in detail the strengths that the country is building on and the gaps that it needs to fill, setting targets along the way to reach hand hygiene for all by 2030. And you can see this is the top half of this roadmap graphic, where they have really mapped out the next 10 years and put milestones along the road. Very nice way of illustrating it. We've already discussed quite a bit on available resources, so I will keep this brief. But maybe just to emphasize, there's a tab where you already use to put your questions in the poll. That is called Files, and I've added a document there with links to all those resources that I think were a good starting point to talk about hand hygiene more in the long run. Among them, there's a launch document for the Hand Hygiene for All initiative and a 2-page brief on country roadmaps, which is brand new off the press, which will be externally published in the next coming days. I also included a few links to webinars that happened over the last few days, few weeks, including the Handwashing Thursday series, but also a regional conference in Asia that happened on the week of Global Handwashing Day. So these are all really excellent resources to base long-term hygiene programming on. Now, where do we go from here? We've already started setting up regional coordination mechanisms and connect partners at regional and country level. So do reach out if you would like to be connected to your partners at country or at regional level. As I mentioned, the first milestone will be at country level to develop country roadmaps. We will support these efforts through documenting lessons learned, the journey that countries have taken, and sharing those lessons learned among the countries. Just briefly, maybe on the roadmaps, it's a process of engaging partners, assessing the current hand hygiene situation, identifying strengths and gaps, defining a vision, identifying and prioritizing actions, and setting milestones on the road of hand hygiene for all. Several countries have already started. I already mentioned Bangladesh, but there's also Nepal, Tanzania that have already started the process. If that was too quick, too much information, have a look at the 2-pager in the files. And finally, we continue to grow this network beyond the usual partners, so beyond the wash partners, so the traditional wash partners, thinking about the Ministry of Labor for workplaces or faith groups for hand hygiene in places of worship. And eventually through all of this work, we're seeking to raise the profile for hand hygiene to secure more investments into the area. So with this, I would like to end with an invitation to reach out to the initiative if you'd like to connect at country or global level. And thank you to all partners of the initiative for this great collaboration, including the Global Handwashing Partnership for their leadership on handwashing advocacy and putting together this excellent event. Thank you.
And thank you, Anita. That's a great foundational presentation of the Hand Hygiene for All global initiative. like to thank all of our presenters and our panelists. Such great topics discussed today, from the basics of the safeguarding measure of hand washing to some of the core key practices for hand washing programming. At the files tab for this event, there are a number of resources, so please go to that tab. One of the resources that we have listed is the landing page for our new hand washing handbook. So please go and view the hand washing handbook, download it, see the related resources there. And also, please join us in the Hand Washing Thursday series. Thank you very much to all of you for joining today. And thank you all for being hand washing heroes. And let's make this not just a Global Hand Washing Day or Global Hand Washing Month, but a Global Hand Washing Year, as Unita said. Thank you all. Bye.